Hi there, my name is Chad Oler, and I put this short video together to entice you to come to the Great Plains Conference in Bismarck, North Dakota on October 6th and 7th so that you can learn some clinical strategies and techniques to address the most common underlying causes of fatigue. For those of you that came to the Great Lakes Conference last year in Bloomington, Minnesota, this seminar will greatly expand on the information that we presented there. For those of you that weren't able to make it to the Great Lakes seminar last year, you're in for a real treat. If I asked you what the #1 symptom your patients presented with when they showed up at your door, it is very likely that fatigue is going to be that symptom. Now, there's going to be other symptoms associated with it, right? There's going to be pain, there may be gastrointestinal imbalances, there might be thyroid imbalances, or any number of other symptoms. But it's very likely that fatigue is going to be near the top of their symptom list. People come in and say things like, I just don't have any energy, or I can't get up and do anything, or just getting through the day is a struggle. These people are really suffering. From a clinical standpoint, fatigue can be a pretty difficult condition because it's so nebulous. It has such a complex clinical presentation that it's oftentimes difficult to figure out not only where to start, but what to recommend and then how to motivate people to be able to do what they need to do to get well. Over the last 17 years, we have seen thousands of people that have listed fatigue as one of the main reasons that have brought them in to see us. Over that time, we've developed a systematic method to not only identify, but also address each person's underlying causes of fatigue. And I'm going to teach you that method at the Great Plains Conference this year. In this seminar, we're going to provide you a step-by-step guide to determine and address the most common underlying causes of fatigue, including nutritional imbalances, adrenal fatigue, mitochondrial dysfunction, inflammation, gastrointestinal imbalances, insulin resistance, thyroid imbalances, and specific medications. In addition, we're going to review techniques on how to structure office visits and manage patient flow in order to maximize your patient's results as well as your income. Specifically, we're going to begin by going through some simple in-office tools that you can use to help you determine not only which underlying imbalances are affecting your patients, but how you can gather more information if needed to put a plan together in order to address whatever imbalances you find. Should you find that you need more information, we'll review which functional tests can be used and how they can be useful in order to determine what you need to recommend and teach your patients in order to help them get well. Next, we'll spend some time going through key nutritional imbalances that can lead to fatigue, as well as how you can help your patients correct any imbalances that they may have. I will also provide you clinically proven dietary protocols, including ways to help them make the transition from where they are now to where we need them to be in order for them to get their energy back. Then we're going to spend time reviewing each of the common or most fundamental underlying metabolic causes of fatigue, again, including adrenal fatigue, mitochondrial dysfunction, inflammation, gastrointestinal imbalances, insulin resistance, and thyroid imbalances. I will show you how you can identify these underlying imbalances in your patients and how you can use diet, nutrition, lifestyle modifications, and supplementation to correct these imbalances. In addition, I'm going to show you how to conduct follow-up consultations to keep your patients motivated and on track so they can achieve their goals. Throughout the seminar, we're going to go through numerous case studies so that you can see how to put these strategies into practice so that you can get to work using them as soon as you get back to the office. I'll also be sure and leave plenty of time for questions so that you leave this seminar with the information, protocols, tools, and techniques that you need in order to address the most common underlying causes of fatigue in your patients. Please join me in Bismarck, North Dakota on October 6th and 7th. I look forward to seeing you there.